everyone, my name is Mrs. Lawa Anita. I want to use this medium to say thank you to everyone on the platform. I really appreciate you being here. I know it's not easy to just accept any platform, but I really appreciate. Thanks so much. So today we'll be talking about self-help skills for children with intellectual disability. So what is self-help skills? Self-help skills helps children with special needs develop self-esteem. You notice most of our children, they don't have self-esteem. One, some of them, they are very shy. Some of them have issues with wearing their pants, wearing their clothes, using the toilet, brushing their teeth, bathing, even talking to others. And some of them have issues taking care of themselves, going to use the mall. See, most of our special children, they can't use the mall, they can't go to the bank, they can't actually drive a car, they can't do laundries themselves. All these are what? Lack of self-help skills. So we'll be learning on how to do it, why it is necessary for us to involve our children in these activities. So that's what we'll be doing for today. So self-help skill also involves cognitive and emotional development. What is cognitive development? Cognitive development is learning to express self and being able to take care of self. Learning to express self and being able to take care of self. That's the cognitive and emotional development. So we need to learn to take care of ourselves as a child, and also for the child to be able to express himself as a child. So now, being to express himself as a child, parents with children with special needs face these challenges. Children having difficulty with self-help skills may be due to bilateral coordinations. What is bilateral coordination? Bilateral coordination is the ability for someone to use both hands to work together in a dynamic way. Now, it's just like when you want to carry water in the house and the child needs to carry a pint of water. Instead of using the two hands to hold the bucket, the child wants to use one hand, or the child is not able to even lift a 5 liter of water up. Why? Because the child has issues with his hands, or the child's hands are so flexible, they don't have strength in it. They are weak due to the fact that most parents don't allow their children to do anything in the house. You see them saying, no, leave him, he can't do it, he won't be able to carry it, just let him be. When the child can't carry water, the child can't hold the toothbrush to brush by himself. When he gets to school, he's not able to also write. So due to what? Not allowing them to do anything. So the child stay, and when the child is 13 years, 14 years, 15 years, you start having issues with that child being able to hold the pencil, or even being able to carry water, or doing anything in the house. The child is not able to do anything in the house because most of our parents, they don't indulge them, they leave them. So anyway, when your child has bilateral coordination issues, you need an occupational therapist, because an occupational therapist will help in the cognitive skill, the fine motor skill, and the gross motor skill. So you need an occupational therapist to help your child, to teach your child the fine motor skill, which entails the coordination of the hands and also concentration. So an occupational therapist will help the parents and help the child know how to write properly with the eyes and the hands coordination. Then we have the gross motor skill. The gross motor skill also help your child being able to carry weight. He needs to do some exercise to strengthen the muscles. So in the house, you may not be able to do such exercise because you are not an occupational therapist, you don't know much about it. But an occupational therapist will actually help the child build those muscles, those necessary muscles that he or she needs to build. So it's very important. Now, what is intellectual disability? Intellectual disability is a term used when there is limitation in a person's mental functioning and in skills, communication, taking care of self, and social skill. So intellectual disability is not just, when we say intellectual disability, it's not that the person is having learning challenge or Down syndrome. No, the person actually has was challenges in every aspect, not just only in dyslexia or dyscalculia. No, so intellectual disability is moreover for every child. Even some children with ADHD has that issue. Some children with Down syndrome has it. With autism also have it. With cerebral palsy also have it. So it's not just for a specific child. Because I know most people will see this topic and saying, oh, maybe it's not for my child. My child has autism. No, it's for every child. So a child with intellectual disability has a limitation in his mental functioning and skills. So either the child is having issues with communicating, so it's not easy for that child to be taken care of, because he can't tell you, oh mommy, I want water, mommy, I want to brush my teeth. So the child is not able to express himself or herself. So it's difficult for you to know, oh, what will I do with this child? What does my child want? So it's called intellectual what? Disability. So that's what intellectual disability entails. It's not just for a particular set of people. Also, types of self-help skills. We have basic activities of daily living. We have what we call the BADL. The BADL is the basic activities of daily living. The activities a child is supposed to do daily. The activities you are supposed to do as a child, and a mother is supposed to teach her child how to do those activities, or a father is supposed to teach his child how to do those activities. It's not a one person thing, it's the parents thing. The both of you have to do this, to teach your child daily. Oh, you have to brush your teeth. This is how to brush your teeth. This is how you comb your hair before going to school. We will notice that if you have an autistic child, you will notice that an autistic child actually autistic children are straightforward. They are this kind of children that anything you do with them today, as far as you are doing it every day, they begin to learn from you. They are used to it. They say, oh, every morning my mom actually take my bath. From bedroom she dresses me up. From dressing me up, we are going to the school bus, or we are eating. So the child is living on daily routine. So an autistic child is actually very straightforward. They learn from daily routine. So when they see you move on that routine, they actually want to follow that lane. They want to be like that. They don't want to leave that particular lane. They just want to be like that. They just want life to continue like that. But as a parent, if you are doing your BADL, your basic activities of daily living every day, you should know how to rotate your daily living for your child, so that your child will not just be there and he's not doing anything. You are the one doing it for him. No. So you train your child on how to do those things. Like using of the potting. Most of our parents have issues with their children using potting on time. They will have gotten to a certain age before they start being bothered. Hey, my child cannot use the potty by himself. But on a norms, you are supposed to start training your child to use the potty as early as 7 months of the child's life. But most of us, we wait till when the child is 2 or 3 before we don't say, oh, this child has a challenge and that's why he cannot use the potty. No, you start on time. If you can put your child on a potty by 7 months, you have a potty in the house at 7 months, the child has started sitting by then. The child should be able to sit on the potty. It's not that he must poo on the potty, but you are doing potty training at that month. So while doing the potty training every morning at 7 months, you put your child on the potty. Every morning you're putting the child in the potty, maybe for 30 minutes or 1 hour. The child is seated in the potty and you are sitting there watching the child. The child will start getting used to it, that, oh, every morning I should sit on this potty. Some children will even see it as their chair. They will just go there and sit by themselves because they started sitting. Most of these children at 7 months, as they just start crawling. So, but they are already sitting. When you keep them sit, they can't sit. So that's why it's a good month for you to actually place your child on the potty, so that the child begins to learn how to sit on his own. So we also want you to teach them how to brush their teeth, brushing of teeth, combing of hair, dressing up, and other things, grooming, feeding. That's another issue most parents have. They have issue with feeding of their children, because when they are supposed to start feeding them, they will say, oh, I have house help, let my house help feed. Oh yeah, feed him, give Michael the food. Michael is hungry, let him eat. No, you start training your child to eat on time. When you start teaching him to eat on time, holding the spoon, you can get a very small spoon for him to start learning how to eat. By the time he eats gradually, he becomes used to it. He gets used to it. But when you don't teach him how to use the spoon, he won't get used to it, and that will not be good, because when he start growing older, he sees it as your responsibility. Oh, mommy is supposed to feed me. That's why I see most of our children are already 13, 14, 15 years. They have difficulty in eating because when they were growing up, their parents were used to sending someone to feed. The housemaid is always feeding them and always giving them food to eat, so they don't get used to it. But when you start on time and you notice that your child has bilateral coordination, problem with his bilateral coordination, you should call an OT. But when you don't start on time, you won't notice if there's any issue with his hands. Oh, this is the reason why my child cannot hold the spoon. I need to work on that aspect. And you call an OT. An OT will actually help you in teaching your child how to eat. He will teach your child a fine motor skill. He will teach your child how to build muscles that will help him hold the spoon and put it in his mouth. So that's the essence of the OT, the occupational therapist. So it's also what needed to teach that child on that aspect. Now, another type of self-help skills we have structural activities of daily living. We call it the IADL, the structural activities of daily living. These activities are mainly done for adolescents and adulthood. Self-help skills include like cooking. Those are already grown. We have cooking, crossing of road, managing money. You teach them how to manage money, how to buy and collect change. You teach them. You send your child on errand, you go with them, and you teach them how to communicate that. That's why most of the special schools we have now, you see they take children out and they take them to go and shop. They teach them how to use the bank. They teach them how to wash their clothes. That's what we call structural activities of daily living. They teach them how to drive, most of them. We teach them how to cross the road, the essence of crossing the road. So when your child is 16, 17, 18, you start pre-introducing these things. When you go to the bank, don't go alone. You go with your child. You teach your child, oh, this is how to use the ATM. It takes time to learn, but gradually this child is learning, and one day this child will actually do those activities you expect them to do. But when you don't put much effort in doing these things, they won't learn. So these are called structural activities of daily living. So like washing of clothes is part of them. Washing of clothes, using the laundry. If you have a washing machine in the house, you can actually teach your child how to use the washing machine, how to pick a call, how to make a call. It's very important. So you teach your children how to do these things. It will help them. So those are the activities of daily living that are very necessary. Now we'll be going on how lack of self-esteem affects the family and affects the society too. So most of these things affect the society, because if your child has such issue and he is not able to mingle with friends, so his self-esteem has been brought down. He can't mingle with friends. You don't want your child to be seen outside. You don't want, if I take this child to this party now, he will embarrass me. So it's important we treat this very well. Take it personal. After today's lesson, try your best. Let me be able to help my child use the potty. Let me be able to help him brush his teeth. Let me be able to teach him how to do these things himself. Don't just do it for your child. Let your child be able to do it himself. So it's very important. So anyway, treatment and management of intellectual disability and intellectual disability. We have early intervention. Early intervention is very important. Early intervention will mean is when a child is a year plus or 2 years and you notice there is something different about your child. Take it serious. Don't just relax. Take it very personal. Oh, let me go and see what is wrong with my child. Go and see your neurologist. Let me know what is wrong with my child. If you know you can't see a neurologist, why don't you look for a therapist to talk to? You look for a therapist and you know exactly what is wrong with your child. So therapists will actually introduce you to a neurologist or tell you where the hospital is that you can use that has a good neurologist. So let's try our best. Early intervention is key, because when a child is not talking and you didn't notice it on time and the child is already 4, 3, 4, 5, you are worried. You start doing everything they ask you to do. You just want to do anything anybody is telling you. But when the child is still tender, it gives you much time to do what you are supposed to do at the right time. So early intervention is very important. It's also help